Welcome to an information video about the brain story. I'm Mary Fearon, and I'm a social worker. I work at Thrive, and I'm the director of the Blue Door program, an exiting program for individuals involved in the sex industry.
Hi, I'm Debbie Curtis. I work with the Division of Mental Health and Addictions with the Department of Health and Community Services, and very happy to be here talking to you about the brain story. Mary and I have been working together for a couple of years now, and it's the brain story, we always say, is not a new concept, but in this current form it is. When I first learned about the brain story, it was back in September 2017, and felt that it really brought together a lot of things that I had knew about and worked with in my practice as a social worker way back in the 90s. And so then a couple of months later, I was in Calgary and at a conference and learned again about the brain story and the work of the Alberta Family Wellness Initiative. And I was out dinner with a friend of mine, and I was so excited, and I was telling her all about it. And she said, "When you get back to St. John's, you got to call my friend Mary." And it all started from there. When I got back in St. John's, Mary and I got together for a coffee and had a great chat. And we launched into quite an adventure together here in terms of how we can spread the message of the brain story and make sure it's part of people's practice in the work that we're doing in Newfoundland and Labrador. And that spans through all or many government departments, many community organizations, a lot of the work that's happening in both healthcare, education, justice, all kinds of work that's happening in our province for the better of the mental health and wellness of people in our province. So very excited to be here today to share it with you and to tell you more about what that brain story looks like.
Yes, I'm really excited about that. And like Debbie said, this initiative was started through the Alberta Family Wellness Center, the Alberta Family Wellness Initiative. And it really is a body of knowledge that describes the relationship between adverse childhood experiences, ACEs, as some of you may know it, brain development, and the risks of physical and mental health issues later in life, including addictions. And the body of knowledge came together through this initiative. They brought together neuroscientists and researchers, healthcare providers, and communities to really come up with a comprehensive and accessible training that would help people understand how people end up where they are in their lives and how life courses play out. And throughout this information sharing that Debbie and I are going to do with you today, it's going to look at the 5 concepts that the brain story actually deals with. And it's important to recognize that this is, like Debbie said, this is not new science. It's something that, I've certainly been working on for many, many years. When I first got involved with GEMA, an organization for the promotion of infant mental health, we were really trying to get a lot of these concepts out. In the 90s, McCain Mustard came out with a study on early childhood experiences, how that influences outcomes for individuals. There's been lots of different research developed and presented over the years. The Sick Kids Infant Mental Health Promotion did a series of videos that was 30 videos years ago that I had also done. And it's not new science. It's just how they've packaged this really nicely into these modules, and you can do them. And it really breaks down the concepts quite easily and accessibly for people. So that's kind of the overview of what the brain story is. And to start that off, looking at those, before we start into the concepts, Debbie's going to look at ACEs.
So as Mary said, ACEs, or adverse childhood experiences, this is not a new concept. Back in the mid-'80s, a physician in California was noticing there were some common themes happening with a lot of his patients, and that launched into quite an extensive study of over 17,000 participants looking at people's experiences in childhood and how then that led to or a common experiences resulting in when people had mental health and addictions issues later in their life, and also chronic health issues as well. So ACEs are those negative, stressful, traumatizing events that happen in children's lives up to age 18 and often result in later health risks across their lives. We look at ACEs in terms of three categories: abuse, neglect, and household dysfunction. Under abuse, we're talking about physical, emotional, and sexual abuse, and neglect being physical and emotional neglect that may happen. And in household dysfunction, things like having a parent who has a mental illness or parent who has a substance abuse issue, having a person in their lives who has been incarcerated, or other issues. Divorce can be one of them, but we also would look at it. We have to look at it more broadly now as well in terms of the impact of discrimination in communities, poverty, and other forms of violence in the community, and peer victimization as well are some of those adverse childhood events that we have to consider. So in terms of ACEs, what we find is that there was in the study, they looked at the surveying people based on those 10 issues or experiences, and then rating people, providing a rate of from 0 to 10. And what they find with those 17,000 who were studied back in the 90s is that ACEs were very common. And most people, over half the people, almost 2/3 actually, had at least one ACEs in their lives. And what they did also find is that while it's not a direct indicator that if you have this many ACEs, then you're definitely going to have this issue in your life, but they did find that it does increase the risk. The more ACEs that people have, the higher the risk for developing some of these experiences, whether it be a chronic disease, heart disease, autoimmune conditions, different cancers, but certainly also mental health issues and behavior such as substance use, smoking, high-risk sexual activity, and ultimately early death as well can be found. When we learn.
Oh, sorry. I was just going to say, I certainly see that. When you're reading this off, and I'm thinking, yes, certainly at Thrive, we see a lot of that in the community when we do all the ACE studies of all of our participants, and they all score 4 or more.
Yes.
And many of them 8 or 9.
Yes. And, when I think back at my work as an addictions counselor, most people who came in, we could always, track back to many of these experiences. A lot of people whose family members had addiction issues or mental health issues. I also think back of when I worked in disability management back in the early 90s, and worked a lot with a physician. And I remember him back at that time talking about the 3 A's. He used to say how, determining who was going to get well and who's going to recover and who isn't. Sometimes we can always track it back to the 3 A's. And I remember saying to him, what are the 3 A's? And he said addiction, abuse, and abandonment. And he said when you have people, when he has patients who have that experience, he can sometimes predict that, this person's going to do better, or this person, will have more chronic issues. And, I think back at that, and it really, he comes to me a lot when I think about ACEs, because he was quite ahead of his time in some ways in that recognition. One of the things when we learn about ACEs, and I've heard this from healthcare professionals and also from people in education and people in justice systems, how when they learned about ACEs, they learned how they grew their compassion really for people who are having, are involved in risk behaviors or have substance use issues or mental health issues, because it takes away that morality and it takes away that blame that people have. And we're not saying that ACEs excuse people's behavior. That's never how Mary and I, how we look at this. But it's more about that it's when people have experienced this, as we're going to talk about now in a couple of minutes, that does lead to some changes in people's development as a result of the ACEs. So it does it does provide some reason, and also can help with reducing stigma when people have felt themselves, to blame for, the situations they get themselves into. But also just, again, having some compassion for people that, in some ways they don't have the skills that we need. And which, again, is all about what the brain story, what we're going to share with you right now.
Yeah. So, and I think that's a really important piece around when you understand that this is not your fault. This is something that your brain actually developed this way based on your experience, that can really shift how you think about yourself and how you can think about parenting your children. I'm influencing that. I have power to make change or not, right? So when we think about the brain story, we're really going to be looking at 5 concepts, and it's the brain architecture, serve and return, stress, air traffic control, and resilience. And we're going to go through each of those, Debbie and I, together, looking at each of what each of those things mean, but really thinking about, and the kind of underlying story behind the brain story is that building solid brain architecture and shoring up resilience improves the health of individuals and, in turn, our whole society. So when kids have a solid foundation for brain development, they're more likely to be physically and mentally well. And in turn, these resilient adults will go on to parent more resilient children. And they're more equipped to nurture these kinds of relationships. And in turn, we have less intergenerational trauma impacting the outcomes for individuals and those cycles of violence and addictions and mental health. The first concept we're going to look at is brain architecture. And brains aren't just born, they're also built. And this happens in stages. So when we think about that, we need to think that brains are not, well, actually the whole thing starts even before we're born, in utero. They're looking at that now. But it's continuous through childhood and into the teen years and beyond, of course. But it's not just your genes. So your brain is born with your genetic makeup. And then those early life experiences influence how that architecture is built. So nurturing experiences are like a strong foundation in the brain development. So if we have early experiences that are positive, that foundation of our brain is really strong. It's like building a house. They talk about that. If you have a strong foundation, you can build things on top of that and the house will last for many, many years. But if you have a weak foundation, you're going to be fixing these problems a lot throughout that time. So things like nurturing experiences build sturdy, strong brains, and things like abuse and neglect, as Debbie talked about the ACEs, build weaker brain architectures. And complex brain circuitries are built on the beginning simpler circuits. So in those early years and early experiences, there's some simple things that are the foundation that it's being laid. And then it gets more and more complex as we mature and develop. But it's important to know that this is all dependent on the relationships with the caregivers we have in our lives and the individuals who influence the experiences we have. So thinking about that. And so moving into the next one, thinking about how those relationships are influenced. So thinking about serve and return. As you watch this video, you see the baby says, "Dada." The dad responds with what the child says, and then the baby is looking at the father and he then hears that the dad is listening to him. And really, the serve and return reinforces circuitries for the basic cognitive, social, and emotional development. And it really is just the baby says something, dada, or whatever it may be, mama, and the dad hears that, he looks into the child's eyes, and he responds with the response of, "Yes, dada, that's right, I'm your dada." And then the baby internalizes that as a positive experience. And those simple actions really influence how that early circuitry is formed, because in the deeper picture of things, the neurons are pruning and developing. What's those important parts are reinforcing that relationships are important, and what this person is saying is helping me survive, because it's all about survival for the baby. Mm-hmm. And sorry. Debbie,
Mary, I was going to say about that great commercial that we saw from
yes.
Alberta with the older gentleman sitting in Tim Hortons or wherever, and they're saying, what did you do today? And one man says, how he's went for a hike, and someone else says, they caught a fish, and the third man says how he was building brains today, and they say, what are you doing? And he responds, you start with peekaboo. And so that's it. It's, he was with his little grandchild and playing peekaboo, which is that serve and return. And these are not, as you said, these are not huge gestures, but these are, those little games that we will play with our children to show that response and attention that we need to do. And they can be taught to young parents to help them do these things. It doesn't have to be these grand gestures. It can be these simple things that
and
we can
really do. It is these simple things.
It is.
It's because our brains, we cannot survive without the adult, so we're trying to get our needs met, and we'll do whatever it takes to have our needs met. So if we say dada and the response is, oh, there you are, yes, I see you, then they learn that, oh, yes, this is comforting and I can get my needs met. I can get fed, I can, get all those basic. But if you don't have those needs met and nobody is looking at you when you say dada, after a while you're going to stop saying it, or you're going to start screaming in order to have somebody look at you. And that could then result in all kinds of other experiences, of course, negative experiences, building on that toxic stress that Debbie's going to talk about later.
Yes.
But it's really critical to that early architecture, brain architecture, is this serve and return. And I often think about this in my own work when we have participants who come in and they haven't had that experience. I think it's never too late to have that serve and return. The participant comes in and sits in my office and starts to tell me this big, long story. And I just sit and listen. I'm not trying to solve it or anything. I'm just sitting and listening. And then I say, yeah, that's really hard. And then they are like, oh yeah, they're not used to that serve and return. And I sometimes think about that, how we can do that even later in life for participants or people we're working with who haven't had those experiences.
Yes. And we think that it's because thankfully for many of us, we did have those experiences, which was very positive. So then when we have our own children, we demonstrate the same maternal or paternal activities. But for people who didn't have them, it's very hard for them then to do it through their own children. And that's where intergenerational piece comes in. Of course.
Yes.
But many, of us, and I remember myself, when I had my babies, talking to them, and I had an aunt who, God bless her, I mean, she said to me, Debbie, you're going to make that youngster foolish, or you're going to spoil that youngster from talking to her so much. And I think, if people got that message, and it was the only message that they got, then they're going to stop doing those things, which is so important to the baby, and to the child. So we have to, sometimes unlearn these long-standing beliefs that we have. And as you said, Mary, that it happens way into adulthood when we respect and we listen to one another. It's where compassion comes in and caring about people and showing them that regard, that people, it can be very helpful to them. So serve and return is a really key concept, I feel, too.
And also, I think about when I first started working in child protection a few years ago, social workers would say to me, oh, they're going to spoil that child. And I would think, what? And I did my very first presentation, I don't know, a few years ago about, it was basically on the brain story before I had done the brain story, about the importance of attachment and all of those things. And I remember really simple concepts around myths with babies. And the first one was, you cannot spoil a child. And people were surprised. And I thought, oh my goodness, no, you cannot spoil a child. Like an infant cannot be spoiled. Pick them up when they cry. They're telling you something. They're communicating. And if you don't respond, you're disrupting that attachment bond. And if you can't do it, somebody needs to step in and do it for you. So really, those messages are certainly, like you said, we all have those people in our lives who say, don't be spoiling that baby, right?
Yeah.
But the next concept that we're going to talk about, that Debbie's going to talk about,
so the third of the 5 concept is stress. And we all know that that stress can be either positive or negative. And in our daily lives, stress is definitely a part of all of our lives. And it can come when we meet new people. And for children, maybe it's their first day of school, their first day on a soccer team, any of those types of things. So when we have a mild stress response, our heart rate goes up a little bit. There's some stress hormones that might start pumping in our bodies. And for a child, if they have an adult in their lives, could be a parent, could be a grandparent or a caregiver, that says everything's going to be okay, you're going to meet some nice new people today, or this is going to be fun, or new adventure, or however way you do that, then that helps turn off that stress response so that the child can continue on their day and manage that. So that is, again, is a healthy part of development. We all have to experience, we all will experience stress, both positive and negative in our lives. So learning those skills in those situations is really important. So it's that, as I said, that caring adult who offers that support so that the event doesn't continue on. They get to the team and they do fine. Another type of stress is, it is more severe stress. It might be the death of a family member. It could be the pandemic that's happening right now. That again, these are, life events that happen. And when we have caregivers in our lives that can help us deal with it, that can be compassionate, that can be kind, help us, experience those feelings and help us work through them, and help teach us skills on how to work through them, that's when, these situations don't become toxic, that they become part of our learning as people, as we go through life. Because again, these events will happen in all of our lives. They do become toxic, however, when people stay in that fight or flight mode, that when your heart rate goes up, the adrenaline, cortisol keeps pumping, because there is, the event is significant, but also that there is no one there to help buffer that stress, help soothe the child, to help teach them some skills about how to cope with it. And what happens is the child turns into, gets into always in that defense mode. So you see children who are experiencing this toxic stress and they haven't learned those skills, that they're in classroom settings and they're having a hard time. They're always in defense mode. And they maybe react stronger than that's really in proportion to what's happening. And it's because they haven't learned those skills. We know that when toxic stress happens for too long, and that stress reaction is happening for too long, that it can disrupt the child's brain architecture, as Mary talked about, and that can impact their development as a result. So toxic stress over time, when it's intense, repeated, and prolonged, it can, impact that brain architecture and lead to significant lifelong health risks as time goes on.
I was just going to say about the toxic stress, thinking about when you talked about that child, I often think about the participants that come in to Thrive. They're like that toddler in a way, like they can't get their needs met in that very moment, and they'll throw themselves into a state of, temper tantrum almost.
Yes.
And then if we can step back and kind of allow that to recognize, then there's that shift. You see that happen then, that if we can just say, it's really hard. I'm going to do everything I can to support you, rather than stop behaving like that.
Right.
That's the kind of influence about how stress can be managed. So even if, that creates that toxic stress, if you respond in that negative way as caregivers or caretakers within systems, we need to be mindful of that. So I think it's really important to think about, they've already had this experience of toxic stress, which makes them respond in the way that they do respond. But if we continue to respond in that way and have an attitude about they're not listening, they're not doing what I've asked them to do, they're disruptive, rather than this is a person's brain responding to their experience, and this is the only way they know how to cope with stress, And this is a stressful situation, not getting your rent met, or having to go into the recovery center, or having to meet with a doctor, or whatever that might be.
Mm-hmm.
Those kinds of experiences can be very stressful, and they don't have those coping. And then they go into this kind of over accelerated experience of how to respond to that stress, because their heart rate is up there all the time, and
all
their
the time.
adrenaline is pumping all the time,
Mm-hmm.
and they don't know how to
Right.
regulate that. So
No.
just thinking about that.
Yes, and it is often where people, sometimes people have that insight that I don't know how to deal with this, and they recognize, I've worked with people who say, I know this is way out of proportion to what's happened, but I
Yeah.
don't know how to bring it in. And
Yeah.
that's where we can help to, whether it's the teacher or whether it's a social worker or a physician or nurse or a community person who's working with this person can help build those skills. But I know people who've had that recognition. I don't know how to, and it leads us right into this this fourth concept of air traffic control, which is the brain's executive functioning system that we all need to function. And when we think about air traffic control, the prefrontal cortex in our brains is responsible for this executive function. And when we think about an air traffic controller, they have to manage all these things in making sure people the planes land in the route that they're supposed to, and to avoid any pileups on the runways and all that. And in our lives, we have to have that same type of control and manage priorities and shift stuff around. And I think about in the mornings getting a child ready to go to school, that they got to put on their boots, they got to find their bag. Did you have your breakfast? Did you brush your teeth? And so it's all those things that we help child develop those skills, because those are skills that they're going to need when they have to go to work and they have to make sure that they got their bus money, or they have they're there on time, their uniform is washed, and everything is lined up in that same way as air traffic control. But if children haven't built that foundation to be solid, then those skills, the problem solving skills, the planning skills, the prioritizing, learning how to focus, if they haven't built that strong foundation, then that executive function is going to be a challenge for them, certainly. And again, it can lead to many concerning issues for them when they get into the school system, may end up in the justice system. All those types of things can be a result of this. I feel, strongly that the good news is that this can be learned later as well. It's always easier in terms of a prevention mode to do things, to learn those skills before difficulties start. However, they can be learned afterwards. And I know, Mary, in the work that you do with Thrive and lots of other community organisations here in the province, that is part. Those life skills are a big part of the work that you're doing, and it takes those supportive people to lead by example, but also to teach those skills to our folks who haven't learned those skills when they were younger.
Yeah, and I think about, it's such a simple concept, this air traffic control, and I've used that with people I've worked with to say, your brain just didn't develop a very strong air traffic control center. So things are coming in at you, and it's too many planes landing at one time. It's a really simple concept to use that is non-threatening as well, rather than this whole idea of your behavior is related to something. It's no, it's really your brain develops so that it can't take in all the messages at once. And you can learn, again, that hopeful message of you can learn how to control this, but it takes time, and mostly it's through experience. So if we can have patience and empathy for individuals that we're working with, that would really change. Because I always think, if you've been in systems for a long time and you've had a lot of negative experiences in your life, and then your experiences in systems replicates the experiences you have in life in your early development, then it's gonna further solidify those kind of experiences as true. But if you step into a place where there's trauma informed, or people are understanding how the brain works, then, and are empathetic to how people's experiences influence them, then that can actually slowly shift how they see themselves, how they move forward, and how they have managed that air traffic control or their executive functioning in their lives.
Yes. So that last concept, Mary, is a very hopeful one.
Yes, building resilience.
That's great.
And that's really the ability to respond positively in the face of adversity. And resilience develops over time. And the fulcrum is a good kind of metaphor for how that works, because we're all born with our genes, and the fulcrum is where it is when we're born. And we hope that it's in the center. And then we have experiences. And if we have more positive experiences, then the fulcrum will shift so that you can have a certain number of negative experiences and it won't upset the balance. But if you have a really heavy end of negative experiences, then the problem is if you have a few positive ones, it can shift it a little bit, but it's not going to shift it enough. And so we're really trying to shift the more positive experiences and positive support and interactions, so that when we have some negatives, like Debbie talked about with stress, tolerable stress and positive stress, we can manage those things. We can develop ways of saying, oh yeah, this happened, but it's okay, because I have, I can call my mom, I can call my friend, I can call my partner, and they'll support me to move through this, or I can call my community center. Mm-hmm. But if you don't have that enough positive on your balance there, on your one side for positive support, then there's no way. It's like if you had 4 friends sitting on a teeter-totter when you were a kid, you could not, no matter how much you pounded on that, you couldn't get yourself to the ground, right? And one person gets off and you could go down a little bit, and another person gets off, you could go down. So thinking about it like that is a way to think about it. But it really can shift, but community is essential to that shift for individuals, particularly when we think about early childhood development and early childhood programming and education, but also, and child protection, or, public health nurses dealing with early parents who are new parents and so on. But if we don't have it in those early years, we can start to think about how we can shift that a little bit as they're older, for older people that we're working with addictions and mental health. So we can make those shifts. But we need to create environments that are rich in serve and return interactions. And we need to work to prevent toxic stress and create good executive functioning, and so that people can continue to have better health, and the better health they have, the better health their children are going to have, or the people around them are going to even have, because it may be that they don't have children, but they're an uncle or an aunt, and they can influence the individuals in their lives in that way. Because, all of these things, toxic stress and the ACEs that we talked about earlier, really impact the long-term outcomes and the life course for the individuals that we're working with.
So, Mary, I like that you talked there about that community, and that community is in the people who can help teach those skills are not just parents; they are those trusted adults or caring adults that are in a person's life. And as you and I are both social workers, but there's many teachers, early childhood educators, police, public health nurses, community nurses, physicians. The list goes on of that community that can provide some of those experiences to help build that resilience for young people. And it's as an adult, it's great to know that we can have that ability to help in those situations. That it's not for naught, and it's not not to give up on people as a result. And I like to tell the story about Fearon Oprah, talk about her, ACEs and growing up and having, these terrible experiences of sexual abuse and leaving her parents and all these things. And when she's asked about, how did you get beyond that? How did you, deal with all that adversity in your life and become successful? And she talks about, a grade 3 teacher, I think, that she had, that showed her that she mattered and that she was worth something. And so I think that's so powerful for like I said, any of us who work with young children or with teens or whomever, to say that we can help build that fulcrum shift that fulcrum so that people can have that experiences, and that community is broad, and our province is broad, and we have many people who are involved and want to be involved in building this as well.
And I also think, when I think about trauma-informed, I mean, that's all the new kind of talk about how people, and I think of that on a scale as well. Because if you're really, truly trauma-informed, everybody in your agency, because from the moment you walk through the door of the doctor's office and the receptionist is there, if she is cranky and not understanding that you're sitting in this waiting room and you're up and down, you're in the bathroom, out of the bathroom, asking her 15 times, when is my appointment? If she's not comfortable with that and understanding that you might have an experience that influences why you're doing that, rather than why doesn't that man just sit down or a woman sit down and behave themselves when they're out in public, they may not have capacity. And we need to think about that as the whole, like every interaction that we have, even when we're standing in the grocery store and the person in front of us is getting on with all their stuff, they're counting out their pennies to pay the cashier, and you're thinking, I got to go. If we can have a place of compassion and empathy for people, to recognize people have their own experiences and we don't know what they are, and we can influence by just being kind, because that shifts how they engage with the world. And it doesn't mean they're going to turn around and say, they're not going to say, tell you off, but they're going to, they really are having that experience of, it's the repeated experience. And that's why particularly when we think about those frontline workers who are meeting for the first time with individuals, those first experiences are going to influence how they move through systems. And we need everybody to be thinking about that, right from the very first person, if it's the doorman that they meet when they're going into the building, right through to maybe the psychiatrist they're seeing at the end, right? So it's really important to think about that. So that's resilience. And so then that kind of brings us to the Brain Story certification, which is a free in-depth course for anyone who wants to learn. And Debbie and I have both done it. And we've had a lot of discussions around how can we get more people to do this. And so Debbie, maybe you can just talk about the network.
So we've talked about the 5 concepts of the brain story, and now we'd like to share with you how you can learn more about it in more depth, and that is with the Brain Story certification course. So this is a course that was developed by the Alberta Family Wellness Foundation, and it's a free, in-depth course, very comprehensive. It looks at all these concepts that we've talked about today and goes into a lot more depth about the neuroscience and the impacts on mental health and addictions. At the end of this course, you do get a certification in the Brain Story. And that certification is often regarded for continuing education credits for people's professional development, which is positive. There's 19 modules, and it's all online. It's all self-paced. You do have to do a short quiz at the end of each module before you can go on to the next one. But that is something that we encourage more and more people to be a part of. So in Newfoundland Labrador, Mary and I have a Newfoundland and Labrador network that we started. First, I guess we started with being a part of a national organization initiative called the Brain Builders Lab, and that's with people from all across the country and in very diverse backgrounds who have come together to help spread this message in Canada. Then from that, we formed an Atlantic group, and so the 4 Atlantic provinces where we work together on different initiatives that we have in place. And then Mary and I felt that we needed to have a Newfoundland Labrador specific network as well. So right now we have about 25 people. We meet quarterly, and they're from a very diverse, all across the province. All different. I just had a scan today through some of the people, and there's people in justice, in education, in early childhood, healthcare, community organizations, teachers. It's just fantastic. And this is the group that we can get this message out very broadly, and how we can make an impact so that people can understand the brain story. And then as a result, when people understand it and can impart it to their clients or the people that they work with, can help people understand the reasons maybe why they behave the way they do, or why they're in situations that they're in, and help people build that resiliency that Mary talked about. So that's very positive.
And thinking about those 19 modules, what I want to say is they're about an hour and 15 minutes each with your quiz at the end. So they don't take a lot of time when you think about the bigger picture. And thinking about what the network is doing, like that's one of the things that the network is doing. It's really trying to think about who can they talk to encourage them, or a department or an individual or a division or a government, to say this is important training. So, we've been working with Child, Youth and Family Services, or Children, Seniors and Social Development, Child Protection Division. And we've been working with, the Recovery Center. We've done training with all kinds of agencies. And the people in our network have also been doing that kind of thing, which is really encouraging. And like at Thrive, for example, one of the things that we do is we have all staff are given time to do that module. And my team, the Blue Door team, I said, okay, everybody start it. We can do it together. And then we can come together and talk about it at the end of each session. And then people go off to their computers and do their test. But also other people have said, no, do so many modules, and then they come back and discuss it as a group. And that's another really great way to do it. But having time within your work schedule that allows for that has really helped. And all of the staff at Thrive pretty much have finished the course now. And we encourage students when they come through, particularly with Snowmageddon this year, and then with the closures with the pandemic, that we have allowed the students to finish that course as part of their hours to get their hours for completion of their student placement, which was really a good way to spend the time. But again, if you can find that within your work schedule, it makes it a lot easier within your training as part of that. And because like the NLASW does recognize that as accredited hours, and other agencies I know have said that they have been able to use that for those credited hours that they need to have for professional development. Sorry.
Mm-hmm. So Mary and I are very excited about the brain story. I hope that came through on this video. And we're always open to talking about it and how we can, share what we've learned over the years. So here's our contact information. But if people are interested in signing up for the course, if you just Google the brain story certification, it will come up. And and then you can sign up. Again, it's free. Anybody can sign up for it. There's also lots of resources on that site as well that you can be connected to. So if anyone is interested, again, feel free to reach out to Mary or myself, or just jump into, if people are interested in joining our Newfoundland network, we're happy to have you too. So
don't hesitate to reach out.
That's right. Yeah.
And thanks for listening today. And we hope you found this helpful.
Indeed. Yes. Thanks, Mary.
Thanks.
Take care, everyone.